Thank you very much, and thank you for inviting me, for the conference organizers to invite me. And I'm really glad about the discussion that ended up the questions, because these are the things that we want to be talking about, open access to research data. And I will introduce myself and just give you an idea of what's going on in Europe and around the world and how we approach this, especially in the medical domain. Let me see. So who am I? I'm based in Athens, but I'm running a European infrastructure program called Open Air, which is one of the 5 key infrastructure e-science projects in Europe. So you have the network that you connect, you have the cloud, you have the high-performance computing, you have data services, and then you have Open Air, which is pushing for open access, first to publications and then to data. We are a very active network with nodes in 34 countries in Europe. And we are a consortium of 55 partners. We are experts in open access from libraries, universities, and disciplines. We have, because we're setting up a technical infrastructure, we have domain IT experts. We have legal experts, because when you're opening up publications or data, or we're talking about open science, legal issues are on the forefront. And of course, we have data communities to drive our processes. This is our site. So when we're talking about open access started about 2002 for publications because of the cost model on the publishers. Now we're talking about open access to research data, and now we're talking about open science. Because open science will give us the transparency, will give us the reproducibility, and when we're talking about open science, it's about open data, open sourcing software, open methodology, how to share your methodologies, how to peer review, open peer review, and when we're talking about peer review, it's not only publications, but it's also about data, and open educational resources. So if you combine all this together, those are parts of the open science, but the idea is that now the scholarly communication, when we are doing research, is how early can we share and what can we share? And this is what open science is about. Before I talk about open access, I would like to talk about research data management, because open access meaning something, if you find something, first of all, it doesn't mean that it's free. And if you find something, it doesn't mean that it's usable. So the idea behind open access is good research data management practices. And when you come to medical data challenges, we have many: technical, ethical, and legal. So how to do stewardship in order to open up the data to be usable. I've got this slide from one of the projects we are involved, and this is one of the data flow for, if you are in the States, it's precision medicine. If you are in Europe, it's a personalized medicine, about the 4 stages of data. So you have the data processing that comes from raw data, from patient data. You have the data mining, you process this data, you mine this data, so you have the next step. Then you use the domain knowledge to create statistical simulation models if you want. Then you have decision support, and then you go back. Just to give you an idea is that this is the bottom part. This is where you retrieve the data, the raw data that we were talking about. This is the top down that comes from the knowledge, from the publications, from the experts. And so the 4 stages are, you go along here, and then when you derive this data, usually it's the vicious circle, is that you use this data to combine with the raw data to change your models and to make it better. So now science, somebody talked about hypothesis-driven. With the data that we have, there is a shift in how science is taking place. And now, in many cases, not all of course, we're talking about data and model-based medicine. And this is where we are going. So data is important. Technical challenges. I will not go very much on technical challenges, just to give you a slide, but when we're talking about data in medicine, we usually talk about big data. And big data, the term has the 5 V's, which is volume, velocity, variety, veracity, and value. When we think about big data, when we talk about big data, we all think about the volume. So this is true, but this is not the only case. Volume on medical data comes from imaging, comes from scanners, comes from all these sensors that are in hospitals or all around the world, because health data now is interdisciplinary and you can use a lot. And this is the volume. Velocity is it comes from too many places too fast and we need to transfer it. Variety is what the heterogeneity that the previous speaker said about is we have so many different no standards, and data comes in and we have to combine, and this is difficult. So this is part of the big data. Veracity is very one of the things that we seldom look at, because it's about the errors. People make mistakes, machines make mistakes, and then we get the data, usually the one that we process, that is erroneous, or it has many gaps, or it has things that we try to fix afterwards. And then, of course, it's the value of the data, which is when you combine everything together, how do you extract this value and the knowledge? And just to give you an idea, because I got this today, about the volume of the data, today in Rome, there is the European Digital Day with prime ministers around, and the voting from the people is which supercomputer application is the most important for the future of Europe. First one is about healthcare. So high-performance computing, because Europe is investing heavily in it, healthcare is one. The data from the healthcare domain and the medical domain is priority number 1. Ethical changes, so ethical challenges. So data ethics and principles. So of course, we all know about privacy. How do we preserve the clinical data, preserving analysis on clinical data for research? We know about transparency, because we are doing a lot of algorithms. We are processing the data, but then we need to explain what we do, and there is no transparency. And of course, there is honesty and lack of bias in the result presentation. I'm not going to go on this, but this is part of, these are the things that we need to move away from. Research reproducibility. The previous speaker mentioned about contacting the 2 authors to get the study, to get the data. Somebody else said that we should have the raw data out, and we should. And it's very important that we find this data and that the data is usable. And I will go afterwards and tell you what usable data is. But reproducibility is not only, data is not the only component of reusability, of reproducibility. Models are also. And you know, most of you of the CONy Webcast studies, that most published research findings are false. And what we need to do as a community, as a research community, is to support the workflows for repeating the experiments. Part of the workflows is the data, but part are the models. And we have to make sure and that we do that, we move along this direction, and that I will explain a bit later on what we do. Oops, I closed it. Legal challenges. Being in Europe, we all know this General Data Protection Regulation, which will be effective from May 28. It's now on probation. That it gives citizens controls of their personal data. What does that mean for medical data? It means a lot. How can we go around it in order to open up data? First of all, there are legal/technical mechanisms. We are thinking of smart contracts and the blockchain. If you've heard of it, the blockchain is the technology behind the Bitcoins, how to share data, not to anonymize, but how to share in a trusted way. We're talking about informed consent, but what we need to come up with, for sure, and this is a very research-intensive thing, new mechanisms of trust, of value-based relationships between the people, hospitals, research centers, and business. And we have to work on all these relationships. Now, coming down, so this is about the problems of medical data. So how do we open it up? Now, in Europe, in Horizon 2020, which is the 7 framework program from 2013 to 2020, there we have 2 policies. One policy is open access on all publications funded by the Horizon 2020. And the other is the open research data. It was a pilot in the beginning, now it's not a pilot. Every piece of data has to be made open by default, and I will explain some exceptions. The thing is, I'm talking about the European Commission because this is where the infrastructure is, but all the member states are following and closely aligning with these policies. And the same policies are happening in NIH, in NSF, in all the big funders around the world. And the G7 meeting of science ministers in June, this coming June, they will issue probably a statement about opening of open science and open research data. So for publications, I'm not going to go very much into that because on the medical domain, this has been with PubMed, this has been in NIH, this has been dealt with in a good way, but in Europe and around the world is no matter where you publish, even if you pay, if you don't pay, or whatever you do, is you have to deposit your publication in a repository. That could be PubMed, that could be your institutional repository, but these are the easy things that you as researchers or as doctors can do. Now, research data, open by default. What does open mean? Open is, if you haven't read it, I would recommend to go and download this, about the FAIR data principles for scientific data management and stewardship. The FAIR principles are that the data should be findable, should be accessible, should be interoperable, should be reusable. What does that mean? Findable means that I will be sitting in my computer, I will look for it, I will get it, I will uniquely get it, the search engine will find it, and I will know all of the information about it. So it has to have a persistent identifier, something that uniquely identifies it. It has to have good metadata, so the machines and the people are really able to relate. Accessible means that I don't only want to find it, but I want to download it. And usually accessible, it's not only by people, but also by machines. Because with a volume of data, we're talking about machines talking to each other. So accessible means that it's going to be able to the data for it to be transferred. Interoperable, what does that mean? Usually it's about semantic interoperability, and when you said about one study having one format and the other study having the other format, that should be part of the metadata, so the machines or the people know how to map and translate. And this is very important. Reusable usually it has to do with the legal stuff. So I find it, okay, I can access it, I know what's inside, I know how to use it, but am I allowed to use it? So we need to think about these issues, and there are global initiatives now. Europe has the initiative from the Parliament and the European Commission about the European Open Science Cloud. So we're building nodes of machines around and services on top of the machines, so this data, based on the FAIR principles, that it can be exchanged. So this is about the fairness of the data. How do you do that, though? People usually, what we do, And if I'm mistaken, somebody said about that the data is left on the computers of the PhDs, and then it's tough luck in going and find them. Is to have to start early in the process. When you get the grant, when you do your experiment, when you think about a data management plan. So planning is the key here, and it pays off in the end because your data will be shared with others, but you will be able to share the data of others, right? So the data management plan is is a tool that will let you do what data you will generate, how to ensure curation, what parts of the data will be open and how. Does it cost? Yes. Research data management costs. For public funding, the public funders are now paying for these costs. And this is something that we all have to think of. What is good for us all, for researchers, is that we don't want to invest in an infrastructure. We do not want to have a lab that we buy a server, we hire a person, and to do this data management. There are national infrastructures, there are hospital infrastructures, there are university infrastructures that they are doing it for us. So just go and ask. And we are sharing the cost, and this is really nice. And as open as possible, as close as necessary. This data for the European Commission that all of the member states will be following is that the grantees, the people who get the money, they have the option to opt out. Why? Because of intellectual property rights, privacy, or might jeopardize the project's main objective, especially when commercial and industry is involved. Those are details of the Commission, but what I would say is that technologies, especially if you claim anonymization, if you claim privacy, then please look at technologies because they exist or they are emerging. 2 more slides and I'm done. But at the life data of the life cycle of the data, it's huge. We're talking about big volumes of data. So the idea is that we have to think is what should be preserved and shared. People are talking about raw data, all of the raw data, because preserving and sharing, remember, we should have it open, but open does not mean it's free, right? It costs somebody some money to make it open. So the data, at least, is that we need to have open the data needed to validate the results in the scientific publications. This is the minimal. The associate metadata, yes, the data sets creator, title, whatever, and follow metadata standards and be fair. And of course, it has to do with the documentation, with the software, methodology, protocols involved. All of this, as much as possible, to the data needs to close to the scientific publications, needs to be open. But what we say is all phases of data should be open. Okay, to replicate a study, how much does it cost? Who pays? The EC has calculated that well-budgeted data stewardship plans should be made mandatory and expect that on average about 5% of research expenditure should be spent on properly managing and stewarding data. So these are the numbers. These are of course, it's who pays how. So it's now we are in an emerging situation where funders thinking this through. NIH has some plans with vouchers to go to Amazon and run your data. It's a complex situation. We're going to go through this, but the key thing is that open up the data. This is very important. And I'm done.
Okay.
I'm done.
Okay, yes. Sorry, we cannot accept a question because we have 10 minutes behind the schedule. We thank all speakers and audience. We right now have the next session, so this session closed. Thank you.
Okay.